I've been doing fat graft now for almost 20 years, and I wrote a textbook in 2006 called Complementary Fat Grafting that really became the #1 seller in fat grafting books for over a decade, and it was sold for almost 15 years. I just don't have the energy to go back and rewrite this textbook now many years later. But I still continue to evolve my technique. And so what's been featured in that textbook in 2006, that was published in 2006 by Lippincott, Williams, and Wilkins, is really outdated because I almost do nothing. Well, I shouldn't say nothing. The basic techniques are still there, but I really don't process the fat the way that I used to. In the old days, I would use a centrifugation process where I would centrifuge the fat at 3,000 RPM for about 3 minutes. If you listen to some of my old lectures on YouTube, you'll hear me say that. And my argument at the time for many years was that there wasn't a huge difference in the processing, whether you wash the fat, centrifuge the fat, etc. In the last few years, I've migrated over to something called PureGraft. It's a proprietary technique that is very different from centrifugation and similar to washing, but also very different. It's an ultrafiltration process and washing system. And what's very interesting with it is my fat graft results have completely changed in the last, I would say, 2 to 3 years since I've been doing this. The things that I've noticed with this technique is significant reduction in swelling. So my patients in some of the old recovery videos that you watched had a lot of swelling and bruising for the first week. And now with this technique, I've seen such a huge reduction in the amount of swelling and possibly even bruising, but I've been using something called tranexamic acid or TXA that further reduces bruising, so it's hard to sort of figure out which one is causing which. But a large degree of reduction in swelling. So it used to be a lot of swelling in the first week. I just don't see that as much. A congested appearance that I just don't see as much. That's one big thing. And the second thing that I see is much better retention. So my patients have much less recovery, much more consistent outcomes, much higher percentage of take after a fat graft. And that has been just fantastic. So why is this different? What is the difference? So centrifugation process, the old way that I used to do it, I would spin the fat down, and then I would take what's called the supranatant, which is basically the area above the fat, which you'll see is just some lidocaine and some lyse fat cells, and then on the bottom of it, which is a bloodier area, is called the infranatant, which I would drain out, and then I would have a column of fat. It would look very pure, but what's interesting is that it had a lot of inflammatory cells. The reason I know this is the results that I'm seeing. But also what's interesting is in the old days when I centrifuge fat, if I pulled out 80 milliliters of fat from the body, 80 cc's of fat, I would get about 40 milliliters of usable fat. And so I would think, okay, I've got these 40 milliliters. Now, when I put it through the PureGraft system, if I take 80 milliliters out, I may get 8. So it's about 1/10 versus 1/2. So you can think about how much of that difference between, let's say, 40 milliliters and 8 milliliters, which is less than a fourth of what it is, that I couldn't use as fat. So what was that in there? So I think it was probably some lyse fat cells that were actually not caught, that seemed to be okay, but they weren't going to survive. And also a lot of inflammatory cells have been processed out. So now that I can take out really all the non-viable fat cells, you can't guarantee 100%, but almost all the non-viable fat cells, the inflammatory components, it's much more work for me because the harvesting takes so much work to get what I need, especially in someone very thin. But I get so much greater reduction in swelling and also a much higher percentage of take. So PureGraft has become a huge component to how I perform fat grafting today.